Hey everyone, welcome to our next presentation. And on this presentation, we're going to be talking about obstetrics and gynecology. And we're going to go over some high-yield topics that are usually pretty difficult for students, and we'll break them down so that they're a lot more understandable. So let's get started. So this is Dr. Iyer with Extreme USMLE Coaching, and we'll start our presentation now. So now let's talk about the beginning of obstetrics, the phases and stages of labor. So what are these? We have normal labor, and that's when you have uterine contractions at regular intervals. So you have regular uterine contractions that lead to dilation and effacement of the cervix, effacement meaning the thinning of it. So the cervix usually looks like a long cylindrical tube, but as you get more and more effacement, it shortens and pulls towards the bottom of the uterus. So it goes from a cylinder to almost a circle at the bottom of the uterus. So you get dilation and effacement with uterine contractions. And with 100% effacement, you get a lower uterine wall joining with the cervix. That's 100% effacement, and that's associated with dilation. And when you have effacement, since the cervix is thinning out, the bloody mucus plug that's located inside of the cervix to keep it closed, when the cervix becomes effaced and dilated, this mucus plug can become disattached, and that results in a bloody show. And that's usually a very common sign of labor beginning. You also get fetal descent with uterine contractions, which is natural. What's the whole point of pregnancy and delivery? To have the fetus leave. So the fetal descent will be very important with that too. And what we do to measure fetal descent are stations. And the station 0 is the space between the ischial spines. So you have -5 and +5. Ischial spine is the narrowest part of the pelvis where the fetus has to fit through. So the narrowest part of the pelvis is considered the 0 point. And -5 means 5 centimeters above these spines, and +5 means crowning. That means the head is coming out of the vagina 5 centimeters forward of the ischial spines towards the outside. So now let's talk about the first stage of labor. The first stage of labor is when the onset of labor to the full cervical dilation and effacement. Okay, so you have first stage of labor has a latent phase and an active phase. The latent phase is when you have slow dilation and effacement of the cervix. So it's very slow, not very quick. It's very gradual dilation and effacement. Then you hit the active phase, and that happens really quickly where you rapidly dilate and efface the cervix. So latent phase will take a little bit of time. When you hit the active phase, the dilation and effacement finish off pretty quickly if there are no abnormalities present. So there are 3 stages, the first stage, the second stage, and the third stage. So let's define them. The first stage is the onset of labor to full cervical dilation, which we mentioned, and there are 2 phases of the first stage. There's the latent phase and the active phase, reaching full cervical dilation. Second stage is from full cervical dilation to expulsion of the baby. So the cervix is fully dilated to the baby completely being removed from the mother's vagina. And the third stage is expulsion of baby to placental delivery. So after the baby has been given birth to, it's the amount of time it takes from that event to the placenta being delivered as well. So these are all important things you need to know that'll help you understand the things we'll be talking about later. So let's talk about a prolonged latent phase now. We talk about the latent phase being the slow onset of dilation and effacement of the cervix. So what does this mean? Latent phase, this is from the beginning of the initial phase of labor. So when you get onset of regular uterine contractions, that's considered the first part of labor. Alright, so when you have onset of regular uterine contractions, this means you've hit the latent phase of the first stage of labor. And what these contractions do is that they will soften, efface, and dilate the cervix because you need the cervix dilated so that the baby can pass through it. It cannot pass through a closed cervix. And now the active phase of labor, there are a lot of different definitions for the active phase, but the active phase of labor is definitively reached when cervical dilation has reached 6 centimeters. Alright, you might see different things, but just remember that 6 centimeters means that you definitely have reached the active phase, and you'll rapidly progress from 6 to 10 and effacement as well. So what is a prolonged latent phase defined as? A prolonged latent phase is different for a nulliparous, meaning no births in the past, so this is her first pregnancy, or multiparous, meaning that this is one of her many pregnancies, 2 or more. So you don't need as much time in a multiparous. As you've done something more and more, it gets easier, and the uterus and cervix are used to pumping out a baby. But however, in a nulliparous girl or lady, you have a lot longer time that you need to define a prolonged latent phase. So you have to memorize these. You have longer than 20 hours for a nulliparous woman for a prolonged latent phase, and 14 hours for a multiparous woman. And we'll talk about what this means. False labor versus true labor. What's the difference? What are the definitions of these? So when you want to talk about a true labor contraction, that means you will have labor contractions that are regular, strong, and more frequent as you keep on going through. So they become stronger, more regular, and more frequent. And also the key thing is they're associated with cervical change and cervical dilation. All right, so if you get stronger, you get more cervical changes, you get more regularity and more frequency, and it gets better and better. That's true labor. False labor is also known as Braxton-Hicks contractions. And these are actually very irregular, and they're not very stable in frequency and intensity. They can go up, they can go down, but eventually they just fade away. While latent labor contractions will keep getting stronger and stronger and stronger to propel the baby out due to oxytocin.